Well, shockwaves are rippling through the United States after the state of Alabama's Supreme Court declared that embryos are children. The ruling involved embryos created through in vitro fertilization, or IVF. The court saying those fertilized eggs have the same rights as children. And Alabama's largest hospital has now halted all IVF treatments. This decision leaves some people without the help they need to start a family. Poppy Embleting has more.
The Alabama Supreme Court ruling that frozen embryos are children under state law is another step back for reproductive rights in the U.S. In the majority 7-2 decision made by the all-Republican court, Justice J. Mitchell wrote, "Unborn children are children, without exception based on developmental stage, physical location, or any other ancillary characteristics." With frozen embryos considered children, this decision has far-reaching impacts for Alabama families undergoing IVF to have a child. IVF often requires the harvesting of many eggs from a woman, then fertilizing them to create multiple embryos. Typically, one embryo is implanted at a time, while the others are frozen for later use or discarded. Under the Alabama ruling, experts are worried about liability. The state's largest healthcare provider, the University of Alabama at Birmingham, has already suspended its IVF program. In a statement to CGTN, spokesperson Hannah Eccles said, "We are saddened that this will impact our patients' attempt to have a baby through IVF. But we must evaluate the potential that our patients and our physicians could be prosecuted criminally." The issue of reproductive rights is highly divisive in the U.S. In terms of the political map, conservative Republican states tend to swing anti-abortion, while majority Democrat states mostly back women's rights to make decisions on reproductive health. However, some Republican states have seen backlash at the ballot box, with voters choosing to support abortion rights measures. Activists on both sides of the argument often go head-to-head in the streets. And in the courts, especially since 2022, when the U.S. Supreme Court overturned the landmark 1973 Roe v. Wade decision that protected a woman's right to an abortion. Advocates and politicians who support reproductive rights have been sounding the alarm ever since about the potential domino effects now playing out in individual states. Poppy Embleting, CGTN, Washington.
Besides legal restrictions, the high cost of fertility treatments is also an issue for many people in the United States. Egg freezing and in vitro fertilization can run up to $20,000, even with company-provided health care plans. Countries such as Colombia and Greece offer treatments at a fraction of that cost, with egg freezing about $3,000. Now, given the price gap, 20% more U.S. patients have gone abroad for fertility treatments in the past 3 years. And that is according to the nonprofit Medical Tourism Association. Wow, what a name. Okay. To talk more about what this means for the future of fertility treatments, we're joined by Kate Tulenko. Kate is the founder and CEO of Corvus Health. Kate, always a pleasure. Thanks for coming in. And this is an issue I think that a lot of people never thought they would go down the road and take a look at. I mean, I know families that struggled for years and years and years and talk about the benefits and really how IVF helped them and really made their life more full with the little one now running around the house. So tell us more about reproductive health care restrictions, such as the one in Alabama. And it seems like it's going to have a chilling effect.
Absolutely. I would say that the majority of extended American families have been touched by IVF. So
right.
It's a critical issue for everyone. And I think that those judges in Alabama who made that decision, I don't think they thought through the ruling and the consequences of the ruling. You know, that a woman who dropped a petri dish with embryos basically was guilty of manslaughter. And that's why you've seen the University of Alabama close down its IVF program, because it needs to make sure it can protect its staff and also protect its patients from potentially being sued. And this shows that it's so important when you make a legal or a policy change to really draw the line and see how it's going to affect things all the way down the road. So if an embryo, whether frozen or fresh, is a child, it means that you cannot dispose of it. Does it mean that the parents have to pay indefinitely to keep it frozen, often at $1,000 a year? Does it mean they have to be forced to implant the embryo, even if it's known to have a genetic defect, and try to carry it to term? And also, what I haven't heard discussed, what
Right.
I think is a big issue, is IUDs. One
Mm.
of the ways that IUDs work is by preventing the implantation of a fertilized embryo, so that
Wow.
basically under these laws would be an abortion. It would not be allowed in these states.
Okay, I want to get back to the cost of planning treatments for future planning, but let's talk about this ruling for just a minute, because you touched on something I was going to ask you about. Do you think that these justices thought this through? Where do you think this is going? Do you think it's going to be overturned in some degree? Do you think there's going to be an outcry? Clearly, it is going to be a political cry from the Democrats coming up this fall.
Well, already there's been an outcry from all corners, because people want families to be able to have children, and people want everyone to be able to access IVF. And so they are going to do some carve-outs. But clearly, when those judges made those decisions, they had not thought that this would automatically halt all IVF within the state. And when you look at the cost of different programs, of course, this is going to just make it more expensive, because there's more legal liability, there's more concern, they'll have to put more safeguards in place. So the reason it's so much Colombia and Greece, one is labor costs, that
Right.
labor is cheaper there, but another reason is the medicines are cheaper, because the woman has to take a number of different medicines to sort of rev up her reproductive cycle and make her ovaries produce more than the normal number of
Right.
embryos. And because Congress does not negotiate with drug companies in the U.S., Americans pay more for all drugs with a generic or brand than any other country. So these drugs are a fraction of the price in other countries.
Okay, let's talk about the future of fertility treatment, the business of that in the United States. Where do you see that going?
Well, we're seeing a lot of new companies come up. It's not what you think. It's not necessarily companies on the cutting edge of fertility treatments. It's companies on the insurance side. We're seeing startups that are bundling the services together as a package, negotiating discounts. More than half of the largest companies in the U.S., that's companies with more than 50,000 employees, more than half of them are offering fertility treatments as a standard benefit. And about 25% of them are offering egg freezing as a standard benefit. And they're offering these services through these new companies that basically are insurance companies for fertility services.
Okay, I have time for one more question, Kate. And I'm curious how you believe the countries abroad are going to benefit as U.S. treatment prices skyrocket. I did not know there was an entity called medical tourism.
Oh, absolutely. Yes. It is a billion-dollar business. Most people are familiar with it for surgery. People get facelifts in Costa Rica, Brazilian butt lifts in Brazil.
I knew it happened. I just didn't know there was an organization that oversaw it all.
Yes, because it is such a big business. And you actually now see hospitals all over the world